Hello and welcome to day 2 of HIMSS Europe 2019. I'm your host, Nicole Couture, and I'm thrilled you could join us for our ongoing coverage here from the show floor at HIMSS. Yesterday, we heard from some of the incredible healthcare professionals here at the conference on topics ranging from blockchain and cybersecurity to patient advocacy and visions of an illness-free future. And, of course, we have another amazing roster of guests for you today. If you're posting on social, don't forget to use the hashtags HIMSSEurope19 or HIMSSTV. We have a jam-packed schedule for you today. Thank you for tuning in. Let's get started with our first guest. Joining me as co-host for this segment is Bruce Steinberg. He's the Managing Director at HIMSS International. Welcome, Bruce.
Thank you very much.
Great to have you with me. Our next guest is Constantine Partion, who is the Vice President of Skolkovo Foundation from Russia. Welcome, Constantine.
Thank you. Wonderful pronunciation.
I do my best. I know Bruce has a whole list of questions for you, so let's let him fire away.
Здравствуйте, first of all.
Здравствуйте.
Здравствуйте. Nice to see you again. So tell us a bit about Skolkovo.
Look, in a few words, it's a very unique place, and it's really like a small city near Moscow where we have more than 2,000 startups.
Oh, wow.
They actually work there, they actually live there, they actually go to school there with their children, so it's a very unique place where you can do the whole cycle of innovation, coupled with quite a few of industrial partners who are also placing their R&D facilities there, which is now in a round of 100 big companies, both international and local players.
And you've brought Skolkovo to the HIMSS Europe 19 conference.
That's right, yeah.
Yeah. And how's it going?
Well, you should ask the guys, but I've just made a check on them. They're pretty happy with lots of traction here. And one of our key missions, I think, is to help our startups to go for international market, and this is why we're here. They're also learning as well on the latest trends, on their competitors, so it's quite useful.
And so you're open to exporting the innovation?
That's right, yeah, that's right. I think this is one of our key KPIs, so that our startups, they have more than just good chances of having a success elsewhere.
And who are the main targets? Are they providers you're targeting, or vendors, or who would you be wanting to speak to at the HIMSS conference?
Well, to be honest with you, I think we're open to every opportunity here. So we're talking to investors, we're talking to potential clients, we're talking to regulators. So basically, you know that to build a successful sale, you need to really think about all the elements of that. So we're trying to think about everything.
And so when you're talking to these innovators, when you're looking to bring them into Skolkovo, are you thinking about the Russian health care system, or are you thinking about export? How do you basically
It's a very good question, Bruce. In fact, it's a very rigorous process which was established a while ago. Before you can become a resident of Skolkovo, before you are given such a status, you have to pass through a very tough test, which is like a selection process. And the key criteria which should be related include such things like the level of innovation, so you're doing something for the first time.
Right.
And the way how you're going to be commercializing. And here, the experts, the independent panel of experts, they have to answer the question whether this particular technology has a chance of succeed elsewhere, not just in Russia.
Not just in Russia.
So
okay.
by design, all the companies that go into Skolkovo, they must have a chance to be successful elsewhere.
That's
it's
fantastic.
one of the prerequisites.
And do you have any graduates yet of Skolkovo?
Oh yeah, quite a few. Yeah.
How many?
Look, graduates means the company which was successful, but I have to tell you that I'm talking about part of Skolkovo, which is IT cluster, which I represent, which I know a bit more than the others. We're roughly 700 companies altogether, and out of which more than half are commercially viable.
Wow.
So they're already quite sustainable business. Some of them are probably would become quite famous in the future.
Okay, we'll be keeping our eyes out. in terms of sectors, you go across many sectors. In terms of healthcare, tell us a bit about some of the stars that you think you have.
Well, if I'm just to name a few, we have some companies which are located here. We have Third Opinion, we have Md, we have companies which are specializing in medical information systems or artificial intelligence for recognizing and reading images. So I think this is pretty much follows the trend which you would find everywhere. So I think altogether we have I would say around 70 to 80 companies which are somehow developing technology for healthcare.
Fantastic.
So it's quite a few.
So you have a mission, like HIMSS has a mission, to help improve healthcare around the world through information and technology?
Well, I wouldn't dare taking this mission on my shoulders in particular, but nevertheless, so we are very much passionate about that. We feel the potential impact which we can provide here.
So for some of our viewers who may not know much about the Russian healthcare system, can you give us a quick sort of summary of where it's at, what stage it's at, and where the healthcare, the Ministry of Health, for example, or the government wants to get the healthcare system?
Well, it's quite interesting. It's very difficult to compare different healthcare systems around the world because they're all having very different starting position, and they're very different by its design, how it's funded. All in all, I think it's quite well organized in a sense that the government used to support this available to everyone medical healthcare. And now I think we're in a position where just simply cannot afford living without having full-scale digital transformation for the same reasons which we are discussing here. This tsunami, silver tsunami, whatever you call it, we are all having the same issues. And I think maybe better late than never, but we are certainly now beyond this phase of realization that government should support some of the initiatives in building common infrastructure which would enable this transition, because with all our best effort and possible luck, but just having startups developing quite unique bits of technology is not enough. We have to plant it somewhere. We have to have open standards. We have to have some integration platform. We have to really understand the rules of the game, how it will be commercialized. So I think in that respect, Russian government and Russian Ministry of Health is doing a tremendous effort. We're not there yet, but I hope in a year or two we will be pretty much having a very good pace of the change.
Okay, you mentioned open standards, so I'm going to ask you a question. So in Moscow, you have open standards. Where do you think it's going to take you? Why open? Why not closed? And what are the advantages?
Well, I think open or closed, it's in some ways a bit of a buzzword, because whether it's open because it's the part of Linux family, or whether it's closed because it's regulated by some other norms and regulations. So I think by definition, such areas like education or healthcare will be heavily regulated by government. So by no means I believe that they would enable things like free flow of the data, personal data, so it will be very subject to very severe regulation. I think in our position here, what we're trying to gather here as an opinion across other geographies is to find the delicate balance between protecting this personal scope of data or national data, and still yet provide some common ground for exchanging the technology and going beyond just one geography. If you really want to develop a strong technological platform, you have to collaborate.
So
I think it's a combination of both worlds. Some of this will be pretty much closed, but the open standards to me is just an ease of integration. So there will be some kind of API to the Russian healthcare system, which will be limited, but still part of that will be open.
Great, fantastic. So if you had a magic wand and you were able to wave that magic wand on the Russian healthcare system, what one problem would you like to get rid of?
Well, tough question. Well, my stake would be to try to make people pay less for their mistakes, especially in developing technology in healthcare, so that they would try and error more, so that we have better outcome.
And that would drive innovation faster.
Absolutely.
You weren't so afraid to fail, right?
In fact, that's the key point. I think this is the only thing, if you ask me to summarize in one word what Skolkovo enables our startups to do, it will be the speed.
Great.
Amazing.
That's fantastic. Thank you so much.
Thank you.
Thank you so much. We appreciate your time.
Thank you.
Cheers. Joining me now is Nigel Hughes, who's the Scientific Director from Janssen Clinical Innovation. Welcome, Nigel.
Morning, thank you.
Great to have you with us.
Thanks very much.
So to start off, tell us a little bit about your session this week here at HIMSS Europe.
So the session we had on Tuesday was ethical and actionable flow of data. And really it was about how do we improve interaction with real-world data, data that's in the clinical space, not in trials and so forth, but also ensure that we protect the rights of citizens, patients and so forth, privacy, consent and so forth. In Europe we have the General Data Protection Regulation, of course, as well, GDPR.
Love me some GDPR.
So it's over a year old now, of course, in terms of being enacted, and we're already starting to see some of the impact of that. It's a very positive regulation, I think. And in fact, we're starting to see others, including in North America and in Asia, looking at GDPR. But unfortunately, we've had a lot of challenges, I think, where it's being implemented and, well, interpreted and then implemented, and these are the two kind of issues that we're struggling with, and that is impacting actually on research even today. Yeah.
What kind of interpretations are you seeing of GDPR that's impacting on the healthcare side?
I think some of the challenges GDPR is a little complicated. I mean, many of us are not lawyers, and we're not versed in European law, but also some of it can actually just be a blank refusal to enable research, to allow interaction with data, and otherwise delay. It's taking a long time for people to interpret this, decide what they ought to do. Europe is, and I say this with a British accent, which is unfortunate, but Europe is not a United States of Europe, of course. We have 28 member states, so we have 28 interpretations also of GDPR at country level, but that falls down to local level, even at institutional level, and so forth. So it's a fair degree of complexity that you need to go through.
And I think adding to that complexity is really the sheer volume of data that we're talking about here, right?
Yes, that's true. I mean, you hear all these statistics about how much data is being produced now, and the most in our history in the last few years and so forth. Actually, even so, and this is some of the larger challenges, not just in terms of privacy and law, some of the key issues is actually how much of that data, even though there's lots of it, how much of it is really useful and how much of it you can interact with. So a lot of data that's in electronic health records, some of it's structured, a lot of it's unstructured,
right.
That's not even captured maybe as well. There's a lot of data obviously now being generated by us, from our smartphones, wearables, digital biomarkers and so forth, environmental and so on. And actually, and that's what you hear a lot about at HIMSS. A lot of issues around interoperability, of course, and these are some of the also key challenges. It's a bit Tower of Babel. We have different human languages, of course, in Europe, but we also have different machine languages, and we try to go from human language into machine languages back into human language for research. It's a challenge.
Yeah, it's a huge challenge. I wonder, where do you kind of start to pull all this data together and really make meaningful use of it?
It's funny you should say that. So the project I presented on was EDEN, EHDEN, or European Health Data and Evidence Network. And EDEN is part of something called IMI, the Innovative Medicines Initiative. Curiously, out of a room of, I think, of 75 or so, only a handful had heard of IMI. It's actually the largest public-private partnership in the world, here in Europe, for healthcare. And it's a commitment from the European Union, 50% funding of all projects, so taxpayers' money, and 50% from industry, pharma, via FBIA, which is our trade association. And so we commit funding, but also in kind, people, time, resources, data, and so on. So over 110 projects, I think, to date, over the last 10 years, and approaching 6 billion euros in funding for all these types of projects in different disease areas, data, diagnostics, therapeutics, all of the above. But EDEN is one of the projects within IMI, and it's a consortium of 22 partners. So Janssen is the industry lead of 11 pharma companies, and then there are 11 public partners led by Erasmus Medical Center and my counterpart, Professor Peter Reinbeck, who's the academic lead, coordinator. But EDEN is trying to respond to these issues. Effectively, we're trying to conduct research via EDEN in the future, with 21st century research with 21st century tools, which we're not really doing now. So it's 3 pillars. One is infrastructure. So we want to create a large-scale network, if you like, lay the digital railway tracks around Europe between all the different partners and sources of data and so forth, and allow people then to run their study trains, if you like, across this network. And we want to harmonize data, that machine and human language issue I mentioned earlier. So we're using something called a common data model. So we map or we link data to this common data model. And then we use the common data model version of all the data from different hospitals, primary care networks, and so on, to do research at scale. So we want to harmonize over 100 million health records, about 20% of the European population within EDEN. We also want to support, and it's one of the reasons I'm at HIMSS as well, we also want to support SMEs, small tech firms. So we will actually train and certify SMEs to do this mapping in a consistent manner. And we've just had an open call for SMEs to apply to do that in April. And the end of this month, end of June, through the summer, we'll have a call for data partners. So that could be hospitals again, or primary care networks and so forth. They can apply to EDEN for a grant grant, a financial grant.
Oh, wow.
And that will cover the cost of mapping their data to the OMOP Common Data Model and pay for the cost of using a certified and trained SME. We kind of speed date the data partner to the SME. So that's a key component along with the harmonization fund of the project. But then we will also run research use cases, validate and verify what we're doing. We're working also with the European Medicines Agency on interesting use cases, things like drug utilization, pharmacovigilance and so forth. But we'll also very much focus on research outcomes as well, so actual outcomes of care in different disease areas. And what we want to see is that the network can support this at speed and scale, but it links, there's not much of a difference in between the source data and the map data, which is really kind of critical, so we need to validate that. We're also in the third, so the second pillar was research, the third pillar is kind of community building and education, so we're setting up an Eden Academy. And that's an open source, open science, open education resource that will be free to anyone that wants to use it around large-scale research using real-world data, bioinformatics and data science, research methodologies and so forth. And we're working also with Odyssey, OHDSI, the Observational Health Data Sciences and Informatics Global Framework. And that's de facto, I think, becoming a standard around using real-world research around the world. Over 500 million health records have been mapped to the OMOP Common Data Model in North America, parts of Europe and Southeast Asia. And Eden, if you like, is going to scale this up now in Europe quite considerably over the next 5 years or so that we'll be operating.
Amazing. So it seems like we're well along on this journey. What is kind of that end goal? What's the dot on the wall that all of this is headed towards?
In a nutshell, very simply, improving the speed to an answer. So, I mean, Netflix and other streaming services are available, but Netflix knows more about me than my primary care physician. You know, because I don't really see my primary care physician very often. But they see me all the time. They saw me last night. I was watching stuff last night in my hotel room. So that's really quick. And in healthcare, we have nothing like this. So even regulators, so FDA or someone like the European Medicines Agency, if they want to know, for instance, the uptake of a drug, the impact in the market, adverse events, these kind of things, it could take months, it could take years to do a study. And today, again, 21st century research or 21st century tools, it's just not acceptable, I think. And you know, at the end of the day, people, citizens, patients want to know more about their own healthcare, be able to manage that, and you can't do that if the flow of information takes too long.
That's right.
So really improving the speed to an answer, but not affecting the quality of the answer, that's kind of the key of what we're trying to do.
Yeah, it feels like we're hitting this kind of strange inflection point where healthcare is on this digitization path and all of this data is coming together. But on the consumer side, you know, I have a Fitbit, I have access to more personal health information than my primary care physician. And it feels like there's an inflection point where the consumer side is not only caught up, but almost vaulting ahead of the healthcare side of things.
It's true, but you're hopefully a very well lady, you know, you're fit and so forth, and you know, that means we're getting data on you as a well person, which is great. But actually, we don't have a lot more of the similar data for people who are unfortunately ill or sick and so forth. That's improving. But it's still an imbalance, I think. So we have a lot of challenges, I think, in getting the right kind of data that's meaningful and actionable. So you know, someone can act on it, like a physician. Versus the right kind of data from the right type of people that we need to know more insights about.
So that sounds like the heart of the challenge, right? Is really getting that data, but also doing it in a way which complies with new regulations, right? You've got to keep up with GDPR.
Absolutely.
Has that slowed things down or helped sort of create a framework to speed it up?
It's slowed it down for now, as I was explaining earlier. I think you know, just interpreting it and implementing it is causing a delay. People are trying to work out how to continue doing what they're doing within a new framework. I hope in time it will improve things. What it's certainly doing is it's improving the need to collaborate. Everyone needs to collaborate. When you're working with real-world data, if you're not collaborating, you're not working with real-world data. So, so that I hope in time will act as another accelerator, if you like.
So Nigel, we are almost out of time, unfortunately.
Shame.
One last question for you. What are you most excited to see or learn here at HIMSS this week?
I think the ever-increasing diversity of not just many of the key vendors and partners that we work with, but a lot of new startups, lots of interest in applications and so forth. Almost, people talk about citizen science. We're also talking about citizen tech, I think.
Yeah.
So you mentioned this earlier with apps and Fitbit and so forth.
Yeah.
But that's been, I think, really very, very interesting how this is starting to really increase and be very, very noticeable here at HIMSS.
Yeah, and it's all coming together in a really, I think, interesting way.
Fingers crossed.
That's right.
Yeah.
Nigel, thank you so much for
Thank
joining
you.
us. We really appreciate your time.
Thank you very much. Thank you.
Cheers.
Thanks.
So next up, we're going to hear from another one of our EC2VC winners. Let's have a look.
Hello and welcome to HIMSS TV. My name is Leontina and I am an associate editor for HIMSS Media, and I'm here with Friedrich Lammer, the winner of the EC2VC competition in the Bloom category. Congratulations.
Thank you very much.
So we're here at the HIMSS conference in Helsinki, Finland. So tell us a little bit about your solution.
Thrive basically is a single SDK that provides health-related data from smartphones, from wearables like these, but also from connected medical devices through one API and through one standard interface to providers of digital care solutions. And that makes it easy for them in turn to use all this contextual data that their users may provide and that their users may bring to better understand the context of their users, of their patients, to improve the individually adapted parts of their service, but also to understand the long-term effects of their care program. And we basically provide the technology to easily adapt all kinds of manufacturers and devices.
That is very interesting. Thank you. And so how did you find the EC2VC competition, and what do you think differentiated you from other solutions that were presented?
There's, of course, been a high-class selection of companies, so it's been all over Europe, and of course, this is a big honor for us to now be the winner. But the other ones were definitely as impressive in my eyes. I can imagine that what differentiates Thrive in this respect is that we provide not a single solution to one diagnosis, but rather more of a standardized tool that can help a lot of these digital care services to improve the speed with which they understand their indication, but also with which they can improve their service. And basically, as everyone and also all the other high-class startups that were with us in the competition are currently on the move to expand digital health visibility and the use of digital health, I believe that we can be a puzzle piece in that, and that may have been the differentiation.
That's interesting. Thank you. And so was there any other solution in particular that stood out to you?
Of course, there was Stetomy, the other winners, with a very impressive monitoring device where we already identified potential overlaps, and where I personally think that this is one of the pieces missing to really get video consultation with a doctor up and running. But also there were the UK-based providers of diabetes with a very strong prevention focus, which again falls back to data that you need to do prevention. So there's been a bunch of other providers. There's been Comate, there's been the other Polish providers of analytics. So yes, there's been a bunch of other contesters, and this makes us all the more proud that we've won.
Yeah, absolutely. And so given everything that you've heard today, where do you think the digital health startup scene is headed in the future?
I think there's a strong push, and also the jury reflected that in their judgment, that they said compared to 4 years ago, solutions have matured, and now all the different indication-based solutions are pushing the boundaries of their market, pushing their user base. And I think this is truly an inflection point currently. For us, we are coming from the wearable and from the technology side more, and we see wearables growing in functionality, growing in features, growing in spread. I think the market is progressing 20% every year, but the same holds true for all the digital care solutions. And this together, I think, is now creating sort of a perfect storm. So there's like the mixture of a real transformation of the healthcare system, where health is becoming more individualized, more tailored to the user, and also more accessible. So if I detect there's something wrong, I can directly get an information on what may be wrong and what I can do about it.
Absolutely. Fredrik, thank you for being here with us today.
Thank you. Thank you.
Joining us now is Kevin Shaw. He's head of enterprise new business at Fujifilm Europe. Welcome, Kevin.
Hi, thanks for having me.
Thank you for joining us. So to kick us off, why don't you tell us a little bit about what you're doing at HIMSS this week?
So at HIMSS this week, we're talking really about AI, how it can affect care, how it can improve patient outcomes, and ultimately, how can clinicians go from what they currently use to something that can augment what they do without it necessarily affecting them in a negative way? How do we get from AI being a concept to being a deliverable, and what can it really achieve, you know, the reality versus the marketing hype?
This is really your wheelhouse, isn't it, Mia?
I mean, I'm super excited. So, tell us about the challenges you tell yourself.
So as we found with clinicians in the past, if you give them different applications and they have to use those different applications to deliver outcomes, they normally find it's frustrating. In radiology in particular, mouse clicks. Too many mouse clicks means that they won't do it. If they have to look at different applications, it takes time. They're massively overworked. So we see in the UK, 1 in 5 roles is empty at the moment. 3 in 5 roles are currently unfilled.
Wow.
There's only 50% of trainee radiologists coming in. So even if you double the intake of new radiologists, you still don't backfill the gap. And then when someone retires at 65 and you have someone new coming in at late 20s, having just finished university, they're super well trained, but they don't have 30 years of experience of looking at images and seeing, what is this that I'm seeing? How do I make the most accurate diagnosis based on what I'm seeing? So we have a big gap, and AI could fill some of that gap. But there are also questions about how do we get clinical validation? How do we make sure this is safe? How do we make sure that it's going to do what we expect it to do every time? And then the regulatory part with most software applications now, you get approval on your application, you deliver an upgrade, you get that checked, and then you send that. Apply that, implement that in the customer's site. With AI, the idea really is about big learning, constantly learning from data sets.
Right.
And how do you stop bias? So we've seen it with autonomous cars, you know, the car's going down a road, does it crash into the lady with a child, the old guy? The human has to make the decision on what it programs the AI to do, and we aren't quite at the point yet where we're ready to get to that point in healthcare. So it's a tremendous step forward to help with the capacity, and it's arduous. You know, a radiologist sits in a dark room looking at a black and white screen, scrolling through black and white images, counting lumps. That's hard work. So if we can automate the process and we can help them, you know, very quickly highlight some things, then they can do more quickly, and ultimately that then means that the patient gets a better diagnosis more quickly, and ultimately the sooner you diagnose, the more chance there is of you having a better outcome at the end.
Right. I think often when we talk about AI, people sort of paint it as this panacea, right? It's just going to solve all
Everything.
of our problems, right? But you made the point of saying, like, some of this process, right? So do you see a sort of interplay where that radiologist remains, but they get to leverage this as sort of another pair of eyes that doesn't get tired in the dark?
So as a patient, I don't want to receive an email from an AI engine saying, Kevin, we found a lump in your lungs, and it's grown 6 mil over the last 12 months. Right? That's not what I want. When I get, if something happens, and it happened to me, something happens to me, I want to sit in a room with a clinician who has eye contact with me, who says, Kevin, got some bad news for you. This is what we're going to do. We're going to do the best we can, but based on what we've seen, we think that we've got a way of treating you. Right? That's what you want. The clinicians, of course they're not perfect, right? They're overworked, they work long hours in difficult situations, and complex morbidity when you've got different diseases. Absolutely. An AI engine can be, so it's very easy to get 4 or 5 coders to build an algorithm which will show on a very specific clinical data set, it will show a calcification, a nodule in a chest, in a lung, in a breast. That's relatively easy. But when you've got multiple different disease types and really complex anatomy and physiology, it's much more difficult. And we see in pediatrics. So when you talk to a pediatric hospital, when you talk to them about AI, what they say is, no one's really knocking on our door. because it's too difficult. There isn't the data set. So, we're talking our platform, Riley. What we're doing with that is we're creating a platform that we have our own Fujifilm developed algorithms. We've got a team in Japan that are doing that. We work with third parties, so we know there are some other companies that have been doing it longer than us. They've got really, really good skill sets. So we'll engage with them to create the transmission method from the X-ray CT MR's taken, gets sent into the system. A broker sends it to an algorithm. It then comes back, and you could have arguably a chest X-ray that goes to 3 or 4 different algorithms, and then the clinician sees it without, then he sees it with one, then he sees it with the second, then he sees it with the third. And based on what they see, all we're hoping to do is give them the best possible chance of making the right diagnosis.
Right.
I just wanted to. There was something that I was curious about. That sometimes, of course, we're talking about the algorithms and so on and so forth, but we also see that sometimes the data gets siloed between different departments. So, are you using any other technologies as well to sort of facilitate that in order for the system also to learn? So the workforce go through the learning curve, but sometimes the system needs to do it too. So, how do you consolidate all these data sets?
So there's tremendous amounts of information around population health. So, my mum's Norwegian, my dad's Indian, I live in London. So I'm slightly unfortunate in there isn't thousands, tens and hundreds of thousands of people like me, so they can't look at my data set and say, oh, based on this, the fact that you eat more fried food than someone in Italy, you're more likely to get this particular disease. So there is definitely some population management and some data sets that are being used to add into this kind of AI algorithm. We're more focused on the image and the pathology. We're not really moving and working with that technology, but there's some really, really clever companies that are. And I was talking to a guy who was exactly in that field, and he was saying, so some of this genomics AI, where they're looking at DNA data and genes, and they're saying, okay, so if we find something out about someone, we then have we have a duty of care to tell them. So there's a whole new business of genetic therapists. So, providing information to patients about things that may happen to them in 20, 30 or 40 years' time. So this whole AI kind of piece, it covers almost every element of life and healthcare. And we're working specifically in one area because that's our expertise. And then there are other areas where I think in time we will create a new platform of proactive healthcare rather than reactive healthcare. So now if you're sick, you go to the hospital, you have an X-ray or a CT, then you see a doctor, the doctor then sends it to a consultant, the consultant then reads the image, he then may get a second opinion. They then have a tumour board, MDT, so then they get 4 or 5 people in the room because it's a bit difficult, they're not sure what it is. So that process can take weeks, it can even take months. And if you have the difference between being diagnosed with stage 4 lung cancer with a 4% chance of survival, or stage 1 lung cancer with a 78% chance of survival, and that's a 74% difference just by diagnosing early. So screening, genetic review, all of those things can move us into a proactive healthcare environment rather than reactive, which is where we currently are.
That's really the goal, isn't it?
Yeah.
So I'm gutted to tell you, Kevin, we are out of time. This has been such an interesting conversation. Thank you so much for joining us.
Thank you.
Joining us next is Henning Schneider, who's the CIO at Asklibas Hospital Chain. Henning, thank you so much for joining us.
Thank you for having me here. Thanks a lot.
We're really grateful for your time. Why don't you kick us off by telling us a little bit about your session this week at HIMSS?
It's an amazing time being here. I think almost more than 3,000 people having here and discussing about, I would say, even though we are all from different health systems, at the end we are all joining the same problems, or I would call it more opportunities, the same opportunities, and we are all aligned in this idea of providing better health with digital solutions. That's amazing to see how so many people focusing on this one aim with so many different solutions, and it's just great to talk to them, to see what they have done in the area, to compare it with their own areas, with their own problems, their own opportunities you have. And especially in Germany, we are really lacking behind the Nordic countries, especially in the way of interoperability, in the way of how to exchange data between a hospital and a primary care, for example, or to the patient. And so, especially from a German perspective, you can learn so much. What is possible? What is already in the world? What is other countries, what can they do, and perhaps where we can be in another 2 years, for example.
What's the most interesting takeaway you've had so far?
The most interesting takeaways are the small startups, the small ideas, especially in company Medexin for exchange data for patients who have left the hospital to do home care and home monitoring. This was amazing and really easy to install a solution which would be perfectly fit to our market as well. Really great.
Interesting.
So you were mentioning that that it's interesting for German perspective to learn more about what the Nordics has done. So, but I'm sure there are very good things going on in Germany too. So what can the Nordics learn from Germany in your perspective?
Oh, that's a difficult question. I would say, of course, there are big companies like Philips who is doing the engineering in Germany, most of the engineering in Germany, and I think Germany is a huge market, and if we partner, if we do things together, we have a much better and higher investment. And I think just focusing on solutions where we can partner, I think this is something we can learn from each other. That would be the best thing. In the part of really in the healthcare system, I really would say we're lacking behind. Perhaps inside the hospitals, if you do digitalization inside the hospital, there are some good examples like the University Medical Center in Hamburg or some of our hospital chain hospitals. They are completely digital, stage 6 and stage 7 in the EMRA model. This is something where we are quite good, just focusing on one institutions, but in the way of interoperability, in the way of exchange, we just can learn from a German perspective.
Well, and I think one of your challenges in Germany must be how decentralized it is. There's not just one big city. There's so many big cities.
You're right.
How do you facilitate sharing of all these new ideas you're going to bring home between such a wide territory, so many people, and so many cities?
Yeah, we are planning together with HIMSS and the Handelsblatt, which is in the German, it's like Wall Street Journal in Germany. We are planning a huge conference in November where we try to align this and where we bring all this experience, especially from this event and from the Nordics to politicians, to decision makers in the German health system. We are doing 2 days of exchange then in Hamburg as well.
Amazing, amazing. Yeah. So we're almost out of time, Henning. Before we wrap, tell us what's the one thing you're most excited to see or learn this week here at HIMSS?
The most exciting thing I really saw was the opening keynote yesterday to get this patient-centric view, why we are doing this and why we have to do this.
She was amazing, wasn't she?
They were all amazing. This keynote was an amazing eye-opener, mind-opener, I would say, and is a huge motivation to go on and focus on new solutions.
Amazing. Thank you so much for your time. We really appreciate it.
You're welcome. You're really welcome. Thanks a lot.
Cheers. Thank you. Joining me next is David Lowe Md, who's a consultant for emergency medicine for the NHS in Greater Glasgow and Clyde. Welcome, David.
Hi, Nicole.
Great to have you with us.
Thank you very much.
So to kick off, why don't you tell us a little bit about what you're here talking about at HIMSS this week?
So for HIMSS this week, we're talking about a program around about COPD and basically thinking about how we redesign a service model to deliver care for that group of patients. So COPD is chronic obstructive pulmonary disease, which is a debilitating progressive lung condition for which people come in increasingly frequently into the emergency department. And what we're trying to do is leverage the electronic health records, wearable data from a watch device, and also asking the patient how they're doing via an app, so patient-reported outcomes using validated scores, to be able to surface and reshuffle the pack, essentially, of who's at risk in the community and prevent them coming in. Because actually the care that I will deliver when they come in at 2 o'clock in the morning via an ambulance is actually something we want to avoid doing. But we know that if we give them the same care that we'd actually get when they come into the emergency department, antibiotics, steroids, potentially nebulizers, if we give that 2-3 days before, we avoid that admission. And actually in the UK and worldwide, it's the second most common reason for emergency department admissions. And then we're motivated to think about how we can change that. It's an exemplar of how long-term conditions can be proactively managed rather than reactively when people come into the emergency department into hospital.
Right. Is this a good case for examining how to take care of these sort of chronic conditions from this perspective? Is this kind of a good example of how that might be applied to other similar
and we chose COPD as an exemplar for that reason, for 2 reasons. One, that the progressive nature of the disease means that actually it's relatively predictable in terms of your increased hospital utilisation as the disease progresses. But then equally, we've got actually, and certainly within Glasgow, a research group that's fairly motivated and has got a lot of data around about these patients. And then the last piece is that For this group of patients, what we're using is home non-invasive ventilation. So if you've got hypercapnic respiratory failure, so your CO2 is high, then we put you on home non-invasive ventilation. And that high-end intervention, which only costs about £1,000 for the machine, can actually prevent those patients from coming into hospital, because those are the guys, if you think of it, in the UK there's 1.2 million people with COPD, and those with the 20% high exacerbators, that's still about 250,000 patients, and if we can put them on a therapy that enables us to manage them in the community, then that means effectively they don't come in, they're comfortable. And actually, whenever you do any sort of academic work looking at what the patient wants, ask them, be it qualitative or quantitative work, the thing that they value is hospital-free admissions.
Right.
So not coming into hospital.
Right. Well, and that makes sense. Nobody wants to go to emergency room,
nobody
right?
wants to come to
Is there a wide range of age of impacted people with COPD, and does that affect how you use technology in order to reach them and to track this?
Yeah, so COPD is interesting because part of the criteria that's most commonly used internationally is you have to be over 40 years old. And that's probably our critical challenge in the study, which is an implementation effectiveness study that we're doing as part of this work. Actually, digital engagement is a challenging piece, because this is a group of patients, if we're to choose diabetes and actually say, let's do diabetics between 20 and 40, these are the people that are more likely to have iPhones, to be digitally engaged. This group is perhaps a little bit more challenging to reach currently, but that's a progressive story. And actually, we're doing a trial at the moment separate to this, and one of my research nurses phoned me yesterday to say actually all 4 of the people that we recruited were sitting on their iPhones communicating with the family despite being in the emergency department. So that shift of being digitally enabled to be able to send them essentially how are you feeling on a phone and ask them questions, and for them to be able to charge their wearable, that's becoming less and less of an issue even as we've progressed into delivering this piece of work.
Yeah, and is it a matter of sort of prompting the patient to take action by sending them a proactive notification rather than waiting for them to download or interact or do something on their own?
So what we're doing with this is we're actually recruiting the patients when they come into the emergency department or when they've come to clinic. So we're identifying patients at that point and recruiting them and coaching them through the requirements. What we're also doing, because these guys often require family care, even if it's just to go out to get their shopping or to be able to mobile out with the house. So actually critical to that is actually getting a carer involved in that to support them.
Right.
The fascinating thing is that really what we're doing is promoting self-management, but it's supportive self-management, because we talk a lot about how we can just enable patients to look after themselves. But whenever we've asked patients, be it with any long-term condition, they actually want to supply the data to help the physician, the doctor, manage their care.
Right.
That's not necessarily in a paternalistic way that we're wanting to take over, but it's got to be a conversation, and there's a degree of trust, so therefore they want to be able to facilitate us to be able to deliver the best care that we possibly can, with the key driver being, once again, not coming into the emergency room at 4 o'clock in the morning.
Right. Sounds like you might end up with a lot of disparate kinds of data as part of this study, though.
Yeah, and that's one of the challenges, one of the key exemplars around about this. Actually, for this project, we're using wearable data, patient-reported outcomes, and aggregating out the electronic health record. And those patients with a severe disease we talked about, they're in home non-invasive ventilation, we're also getting physiological data from them. What we're doing is working with Kensai, which is a Microsoft partner, and they're doing the data piece, the machine learning bit. And actually, that's been part of the critical part of the journey, has been an understanding of how we can effectively risk stratify based upon these, as you say, disparate data that often might not be there all the time because they forget to put their watch on or they don't answer the questions. And it's how we manage to deal with that to answer 4 key actionable insights, which are, firstly, are you at risk of an exacerbation in the community, in which case somebody should see you, contact you, and there's a messaging service within the app. The second one being treatment failure. So if you're on long-term oxygen or home nebulizers, do you need an uptick of that medication proactively rather than you crash landing again into the hospital? Anticipatory care planning. So if you're at the point of end of life, 6 to 12 months from that period and on a prediction, then actually we should start having that conversation with the patient and the family about palliation and comfort and support. And lastly, it's a safety piece when they come into the emergency department, and also part of operational efficiency, ED prediction. So do you need to be admitted? And what's your length of stay within that hospital system? Because really what we want to do is be able to identify those at risk, and if they're in, think about their risk of return, because actually what we want to do, and that's the same in any condition that comes into the hospital, that really what we want to be able to do is think about those key metrics of performance that are patient-centred. that actually enable us to safely manage people, improve their quality, but understand the variation of care and try and reduce that.
That's really interesting. I am gutted to tell you we are almost out of time,
okay.
But before we wrap, tell us what's the one thing you're really excited to see or learn here at HIMSS this week?
I think the thing that's really exciting to see is what everybody else is doing and actually just fitting the puzzle together. And a lot of that is about the baseline technicalities of how the data is shared, how you get the population of your country to accept how that governance works, and be able to take those key learning and be able to think about how we do that in Scotland.
Yeah, that's really interesting. David, thank you so much for joining us. It was really interesting. Joining us now is Mikko Vasama, who's a health...
Introducing policies, guidelines that really drive the adoption in Nordics, for example, is important. Then secondly, I would say that very important is to look at the patient perspective. So again, as it's a publicly funded healthcare system, that means also that all the citizens have the equal rights to receive the healthcare at an equal level, regardless of where they live, for example. So that requires access to technology and of course, skills and capabilities. And that is then training, education, coaching. So that is definitely a need. Then thirdly, I would say there's the healthcare providers' perspective, so healthcare professionals. Again, similarly, they need to have access to healthcare, but also the training and education is required. And I would say also that you can't just add to their current work or their current model additional sort of a burden from this, but actually you need to redesign and rethink workflows, patient flows, and really think through how do we actually alter the model to enable this. And lastly, I would of course highlight the technology perspective. So we need to have technology that is easy to use, friendly, and something that really enables the patients to communicate with the healthcare professionals and capture their vitals at home and so on. So at least those four elements I highlight to this question.
So I mean, there's a lot there, right? What are some of the barriers standing in the way of the sort of successful implementation of the hospital of the future?
Right.
You listed some of them, but maybe we dig a little deeper into some of those. What are some of those barriers?
So I would say the current model. So again, if you look at Nordics or look at Nordics, so we have a very well-established healthcare system that has always been there, and it's working well. But at the same time, we actually as Philips, we just published here at HIMSS a fourth version of the Future Health Index, and one of the findings from that was that actually, we need to look at what countries like India or China are doing when it comes to adopting new technologies. And they didn't have the legacy, well-established system, so they sort of jumped a couple of hurdles to really leverage the new technologies. And we should look at learn from them. And I think that is one of the things that would help us in going about those barriers. Of course, there's the skills and training and capability, which I already mentioned. But then I would also say that the limited resources. So we are really scarce. We have scarce resources and there's lack of professionals. So we really need to look at how do we redesign the whole model to enable this. And of course, technology can play a big role there to make this happen.
Right. Well, it's a little bit like trying to change the wheels on a bus as it goes down the road, right? All the people who would like to make the changes are the ones who are already working.
Correct. Yeah.
So what technology then is needed to overcome some of these challenges?
Yeah. So technology, I think if you look at it from a patient and provider perspective, so I already mentioned in the previous comment that we need to have very easy to use, patient-friendly data capture at the patient end, and connected to that also the communication capabilities, so you can really communicate with the providers, but also caregivers. Come to the other side, which is the provider perspective. So we need to have dashboards or scorecards that really give you the overall population view on the population that you actually treat. And I think those parts or those elements need to be resolved. But I will also highlight the importance of solving the issues that we face with data, data management, interoperability issues that we might have. And we absolutely need to have secure and safe data transfer capabilities.
Right, that's critical. So Philips is focused on connected care here at HIMSS Europe. Can you tell us about some of the technology solutions you're going to be showcasing this week?
Sure. So, of course, there's a lot. And you should come to our booth to see those. But,
Definitely.
But let me just point out two. So I think our population health management solution, which is called Vital Health, that is one thing I want to highlight in the context of this discussion as well. So we have a solution that actually can provide both the actually three things: the communication platform, so that the patients can communicate with the providers and caregivers and the community. We also can, with the platform, capture the vitals and capture the measures from the patient home and share that with the providers. And then thirdly, I would highlight that it also has the capability to really measure the outcomes and give you insights to patient conditions. So that's one very interesting element of what we're showcasing here today. Secondly, I would then highlight our data integration platform called 4Care, and that is something that really can take silos of data and turn it into a really important patient information. It's about seamless data exchange and reduction of resources and time in terms of data integration. So those two I would like to highlight.
And the third?
No, I said two.
Two? All right, that's great. What are you excited about for this week?
Well,
what are you most excited about?
I'm a Finn, right?
Right.
So this is my home country, a home city.
Yeah.
And really excited to see a lot of international guests coming over here, and then, of course, a lot of Finns and Nordic people coming to Philips booth. And I'm really looking forward to engage with our customers on our booth, and then, make the most of it.
Fantastic. Mikko, thank you so much for joining us. We really appreciate your time.
Thank you.
Joining me now is Joanna Matson, who is the Director of Comprehensive Cancer Center at the Helsinki University Hospital's Comprehensive Cancer Center. Joanna, welcome.
Thank you.
It's great to have you with us.
Great to be here.
Why don't you tell us a little bit about your sessions here at HIMSS this week?
So yesterday I was talking about creating and developing digital solutions for cancer patients. So we started to collaborate with a small startup Finnish company for 6 years ago to develop digital solutions for cancer patients, and the whole idea was to get easy access to the hospital for cancer patients, because it was difficult sometimes to reach the nurse by phone, and we wanted also to develop how the patients can contact and report how they are doing during treatments.
That's really interesting. So it's a way to sort of drive better outcomes for these patients by connecting them more deeply with their caregivers?
Yes, that's the case. So we started the work 6 years ago, and then a couple years later came out very striking US results that breast cancer or other cancer patients who have metastatic disease, and they report how they are doing during chemotherapy by digital solutions. So they live half a year longer.
Wow.
And the similar results came also in lung cancer patients after primary treatments, when they were followed up and they reported digitally their 12 most important symptoms. So they also lived 7 months longer. And it's amazing, and they could also, the quality of life improved, and also in the first study they could show that the emergency room visits and hospitalization decreased. So now we have an idea that during the tough cancer treatments, we don't ask, and the patients probably not always report in detail how they are doing, and if we can identify in detail how they are doing and treat them earlier on, so the treatment outcome can also be better.
That's amazing. Those
Yes.
are really significant increases, all just from improving connectivity. So
Yes.
that I imagine it brings out issues that ordinarily a patient would feel, this is just a small thing, it's fine, I'll
Exactly.
tough it out.
Yeah.
What kinds of connectivity did you introduce? Is it phone? Is it an app? How did you engage?
So it's an app, and we started a collaboration with a startup company. So they had the expertise to design IT solutions, and of course we had the expertise to how to treat patients and what's important. So we also added a little bit intelligence in the solution so that it could also send automated answers. But as a matter of fact, the whole idea is that you have your named nurse there digitally reachable. So wherever you are, if you are at work or if you are traveling, so you can easily get connected with your care team.
Right, and that care team stays the same, right?
Yes.
It's the same person you're going to reach out to. I imagine that improves the comfort level for patients as well.
Yes, exactly.
That's amazing. You were also on a panel session this week as well, weren't you?
Yes.
And what was that about?
Well, that was about the public-private partnership. So as a matter of fact, we were kind of pioneers at our big hospital. We started that collaboration, and I really enjoyed it. And it was so great to because we had, as I told, a really bit different expertise, and I think it's very important that also the products that we created, there was nothing in the beginning. So it really came into a real need. So, and I think that the result was good. So both partners, so we really put all our passion in the collaboration, and it was fantastic how it developed. And as a matter of fact, now our common baby is doing well. So she has moved abroad, and she now lives at Palo Alto. But still, we use and we still develop the solutions. And as the very latest module to that family of digital solutions, we have created a solution to support cancer patients, to give psychological support. So I think it's very important because nowadays people are very used to taking care of various things digitally. So it's some of the patients, they really don't want to come to the hospital face-to-face visits unless it's necessary. So it's very important that we develop these services. But on the other hand, it has to be the patient's choice to use them.
Right, right.
And as a matter of fact, we made a big randomized study in Helsinki. It was almost 800 patients with breast cancer during follow-up. So we did it for 5 years ago, and we could find out that 60% of the patients were willing to use digital solutions. And the eldest patients were 83 years old. So it's not a matter of age, it's a matter of how you are used to taking care of other activities in your life.
Right.
And this doesn't mean that we wouldn't meet face-to-face the patients when it's needed. Of course, you have to come for your chemo and certain visits. But then there are so many times that you could avoid coming to the hospital.
Yes, and for someone who's already ill and already going through, fairly tough treatments, I imagine the fewer times you can actually go into the facility, go in to see the doctor, the better, right?
Yeah, exactly.
And it's interesting, there was a sort of, was there an age difference in terms of folks who really took that up, or was it more around the comfort level of technology already?
I would say that it's more the comfort level of technology, and of course it's mostly younger citizens, but also elderly. It's really how you are used to dealing with other things in your life.
So I wonder, how challenging has the implementation of some of these solutions been? I have to think that's a bit of a steep hill to climb.
Yes, that's a fantastic question, because we have discussed this a lot at this fantastic HIMSS meeting, and what we found out was that we should put in the nurses' daily schedule digital time, because if you try to add something extra on in the beginning, so then they may be against the change. So it's very important that it's also visible that people who are, because in the end, in the lung cancer big randomized study, so it took 15 minutes for a doctor to follow 60 patients per week. So in the long run, if you design these services in a clever way, you can really also save professionals time. But in the beginning, you must add digital time so that they get used to using and get the benefit from the solutions.
And is it challenging to get caregivers on board with this idea that, it's going to be tough in the beginning, we're going to have to fit this in, but then ultimately it will make things better? Is that a challenging conversation with physicians and nurses?
Yes, I think, but very soon, I remember when we started, our breast cancer app was the first one we created. So very, very soon, I got feedback that this is the way to do it. So really, so that the patients who are motivated to use it and the nurses have the time to get used to the new ways of contacting patients. So then afterwards they feel very, very happy.
Right.
Both.
And I have to think it's very helpful to actually just schedule that digital time rather than expecting that a busy nurse finds another hour in the day, right?
Exactly.
Yeah.
That's exactly the point.
Yeah. And so where has this been taken up? Are there specific countries? Is it here in Finland, or where else have you guys experimented with this?
So now it's in the States. So as a matter of fact, the company, Finnish startup company Nuna Healthcare, was bought by Varian, a US company. So nowadays it's under Varian, but it was. The product was designed here in collaboration with doctors and nurses at our Helsinki University Hospital and Nuna Healthcare.
It's interesting, the angle of having a startup, right? I think we often don't think of hospitals or universities necessarily collaborating with little startups to get their technology and then to work together. Was that tough to get on the go?
Well, I have to tell you that it was by accident. It was the CEO of the startup company. He called me and asked that if I would like to start to collaborate with him. It was 6 years ago. And I asked him that was a nice call, I'll be back. And you know that sometimes you'll be back and sometimes you don't. But during the following week, a breast cancer patient who was unhappy with our services, so she wrote in the biggest newspaper of Helsinki that she was not happy with our services. And then I connected these two things, that now I have to call to the CEO of the startup company. And that is how our story started. So we started to develop to serve the patients better. That was the primary goal, and it still is.
What an amazing way to come back from what was probably an uncomfortable day, let's say.
Yeah.
So Joanna, I'm gutted to tell you that we are almost out of time, but I want to thank you so much for being with us. This was really interesting.
Thank you.
Cheers, thank you.
Hello, this is Stephen Wellman with HIMSS TV. We're on location in Helsinki, Finland at HIMSS Europe and Health 2.0. I'm here with Elena, who is the Managing Director of Health and Life Sciences with Microsoft. Thank you for joining us today.
It's a pleasure being here, and it's great to be in Helsinki.
Yes, it's a beautiful place and full of exciting news here at the show this week, right? We're hearing a lot about the future of healthcare, envisioning healthcare, but we're also hearing a lot about the future that's already here. Help us understand a little bit about how we can better envision healthcare and maybe even see some of those glimmers of the future that have already shown up.
Yeah, it is really true that there's never been a better time to reimagine healthcare. Let's start just from there. And then let's be bold and say that the future that we like to imagine is showing up in pockets already now. And definitely one of those places where the future is showing up is Finland. When Microsoft thinks about the way in which we can reimagine healthcare, we really bring it to the core of how we can empower clinicians and patients and health organizations to do what they do best with new tools, and therefore to achieve more. And that more is really about better outcomes. Now, if we think about the learnings from 10, 15 years of digitalization, we know that there is a sense of fatigue. Sometimes people call it the desktop medicine, entering data and not having seamless experiences. So reimagining healthcare and looking at the future really goes to the very heart, the point of reimagining experiences. Experiences that make sense for clinicians, that allow them to save time and see more patients. There is an expected shortage of 13 to 14 million clinicians in the coming decade. So we do need tech as a companion, as a support. Similarly, when we think about the data explosion and the ability to get more precision medicine from data, we do need the tools to analyze it. We cannot hope to achieve those type of outcomes in an on-prem world. We need to shift to the cloud in a trusted environment where we can make sense of data, we can reason over data, and we can achieve better outcomes. If you allow me, when I think about what we do and what we don't, right, there is a sense of focus. From a Microsoft perspective, we think about reimagining healthcare in 3 ways. First and foremost, making sure that we really enable that personalized care, that we empower the care collaboration and care coordination and communication with clinicians, and then that we improve and enhance the outcomes from a clinical and an operational standpoint. These are the 3 areas of what we do. And how we do it is really from a cloud platform and AI capability standpoint. Underneath that, you need to spend time and focus on trust, on responsible artificial intelligence. What are the principles that are really driving AI solutions that people trust, understand, and adopt? They feel comfortable that there is no bias, that they are inclusive, that they are fair, transparent, and so on and so forth. And that we as an engineering company, as a software engineering company, we make those investments that will make our product fit for healthcare. That is where you start putting the foundation for reimagining the healthcare that you want to see.
Oh, thank you so much for that explanation. And let's drill into that a little bit. You mentioned successful migration to the cloud, successful use of data. Could we talk a little bit maybe about an example here in market where a provider or a clinician has done this?
Yeah.
Have made that transition?
Absolutely, and that's why I say, the Finland is a great flagship of the future we want to see. If you take the Helsinki and Uusimaa hospital network of 21 hospitals, right? What we see today is the result of 5 years of journey to the cloud. And they have reimagined the hospital beyond the bricks and mortar. They have reimagined experiences of how citizens can receive care, particularly if they have chronic conditions, from their living room. They no longer need to go to the hospital. Will the hospital always be there? Yes, for very specialized and more complex conditions. But today in Finland, there are over 600,000 people every month receiving digital care from their living room. That is bringing, enormous amount of savings. So HIMSS has digitized the hospital, extended its reach, digitized the pathways, but also changed the foundation of how it does medicine and brought the cloud into that mix. So they have actually rethought about the operation in view of a data lake, thought about an ecosystem of technology solutions that contributes to reason over data and provide intelligent solution. And I'm talking about an ecosystem of solutions. So that means many different partners. We need to start thinking about interoperability of solutions, agnostic to the device or the operating system, making sure that the experience that patients have is independent of the vendor of choice.
Great. And then kind of one last question here for you, though I have a feeling maybe we might have time for another one. Interoperability, hearing a lot about it here at this event. What is some guidance you might provide to any providers out there looking to improve interoperability, and what steps can they take to ensure that their patients' data can be accessed wherever they may need it?
Yeah. So there is no future of healthcare without interoperability. Let me put it there very clearly. If you think about the fact that 34% of collaboration is happening within a hospital network. And then we go down to 10, at best 15% of data being shared and interoperability of data and solutions across countries or across that network. We realize that there is a big gap and an untapped potential. Now, Microsoft, for example, embraced the interoperability journey very early on, but specifically in healthcare, we actually embraced FHIR standard as the new frontier for interoperability, making sure that applications and solutions could talk to each other. We announced the Azure FHIR, the Azure server for FHIR, back a few months ago, and then the Azure API for FHIR as the first step in our interoperability journey. Now, I think that it is important that we keep the interoperability as the North Star, right? We have seen a lot of systems of record coming to the market. We need to make the shift from systems of record to systems of engagement and systems of insight, so that the data can be extracted from various solutions, can be brought together and create an experience for the clinician when they need it. Again, independent of the silos across the different solutions. From a tech perspective, never before you could do such type of thing compared to now where we are in a cloud and AI world.
Thank you for the answer. And then one last question. We've talked about envisioning a future of healthcare, particularly talked about the role that migrating to the cloud and data is going to play in that, interoperability, FHIR as a standard. What comes next after that? Help us envision a future beyond the future.
The future beyond the future, I think, is tech intensity. And that means that not only we need to bring to market those great tech solutions, we need to be sure that there is a motion for adoption and there are the right organizational and tech capabilities that really make sure that those solutions are being used, that people grow into the mindset of what digital experiences are all about. So I think that being able to work on digital culture, on digital capabilities, and also really support that journey of digital maturity is something that is a shared responsibility for all of us. And with all of that goes the element of culture and trust. Because if we do not trust the innovation that is in market, nobody is going to use it. People keep being skeptical, and skepticism gives you a very comfortable position for not adopting what then you see, what then you have at reach. So that is a big one in which I think we all need to work together. And hopefully that's the future beyond the future.
All right. Thank you so much for joining us today.
Thank you.
This is Stephen Wellman with HIMSS TV. Thank you for watching.
Joining us next is Zoltan Lantos, who's the head of Social Innovation Lab at IASK. Zoltan, welcome.
Very nice to be here.
It's great to have you with us. Why don't you tell us a little bit about what you're speaking about here at HIMSS this week?
Yeah, I'm here to speak about the human factor because health is generated by ourselves. So this is a product of ourselves. We need to generate every day, 24/7, and we need a lot of energy for that, and we need special resources for that. And we know from different studies that social network is one of the most important resource, and spirituality the other one. So we can take that individual effort and community effort in the basement of health.
Interesting.
I think this is absolutely fascinating and plays to some of the conversations we've been having at HIMSS. We are going through a journey at the moment where we're actually starting to appreciate far more the importance of people in technology. because it's all very well to have the technological tools, but as you quite rightly say, unless we activate people, get people involved and engaged, we're not going to get there as fast as we otherwise would be. So talk to me a little bit more about how you're actually activating that population, how you're getting them to get engaged in their own health and care, because we know it's not easy.
No, it's fairly difficult, and we know from global studies that about 1/3 of the population is ready to collaborate because they have the sufficient energy for that. And we also know that in different populations, 10%, 30% has not energy for doing something for themselves. So they are really the lost proportion of the society, and with pure health support, you are not able to bring them real health. So social welfare and healthcare should be aligned, and very strong promotional programs need to be settled for that population. And in the middle, they need a lot of support, different kind of support, personalized support. So personalized behavior medicine could be a very good support for that. And we know that from AI and with the collaboration of human and machine, we would be able to develop a proper ecosystem for that support. But first, we need to learn much more about health consumers, health behavior, because we know very little about it. And we have done several researches to explore the so-called key experiences. So, for example, we look at COPD. Everybody is concentrating on smoking because this is the enemy at COPD, but it's almost difficult to achieve the smoking cessation. But the key experience for the people, for those people, the movement limitation. So if you provide one single little step towards a better everyday movement and freedom in the movement, they have a better experience, they learn how to manage themselves, and later they realize that, smoking cessation would be a good idea.
Yes, you're talking about not only activating people, but sensitizing people, which is really what we're talking about.
That's right, that's right. Sure. It's interesting. Do you find different results based on age group or where people are located? Are some countries more challenging than others?
We found that those emotions are really global.
Right.
So in that respect, we can rely on different researches, and we found out that the Chinese people very much the same as the American and the European people in that respect. So the disease-specific key experience is very much alike.
That's amazing. I love that. But it also means, I imagine, you can leverage data from multiple different countries.
Yes. The way you deploy it, of course, is going to be the challenge, because the actors are different and you have to deploy it in a different way. Which
exactly. Communities are different, regulations are different, access, different habits are different. And legacies are different. So the overall communities are different.
Have you played with this? This is really interesting stuff, and this is really at the frontiers of where we're going.
Absolutely.
I mean, this is very exciting. Have you played with gamification here? Because I know people who are doing that, which is really fascinating, using affinity points to encourage healthy behavior and using what we call nudge.
Of course, nudging, yes, exactly.
Get those healthy behaviors,
exactly.
And actually assisting people, not forcing people, but assisting people to do the healthy.
Of course. Yeah, that's the point. Gamification is the key. Virtual reality, augmented reality. So we have a huge new word to discover, and agree gamification, and to first understand the key experience, then build a game. A live game on that, and when you collect points and you are incentivized to do so with the insurances, that would be a completely different new word.
This world is happening, by the way, in some parts of the world, which is fantastic.
Well, gamification doesn't necessarily need to be a game, right? I compete with all of my friends to make sure we all get our steps. We all encourage one another, make sure we hit that 10,000 mark every day.
Yeah, gamification is the technology. It's more about experience.
Yes.
Good experience, because as human being, we decide on own experiences, and health is actually set of experiences, and we want to involve people. We want to achieve good experiences on the activities that are beneficial for them.
Yes.
So technology is very important, but we need to change our mindset and concentrate on human experiences, not user experiences, not technologies, rather the deep instinct and deep emotions.
I'm sorry, I'm going to use my terminology here, but I like what you say, because I often feel that sometimes we concentrate on the boxes and wires so much that we forget why we got the boxes and wires in the first place.
Mm-hmm. Yeah.
So really the application and contextualization of the boxes and wires is what you're talking about. This is the new future. This really is the new frontier in healthcare. We've concentrated a little bit now on deployment of digital systems within health and care. Yeah. We haven't yet started our journeys in this place. And this is going to be the most exciting time.
Yeah, exactly. I agree. But on the other hand, we need integrated data. We need very good data sets. And here in the Nordic countries, they are very good at that. And we need to learn from different data set, individual data set, and that would be the basis of the next generation experience sharing, experience augmentation.
Yep.
So unfortunately, we are almost out of time. But before the clock runs out, I would love to hear, what's been the most exciting or interesting thing you've heard or seen this week here at HIMSS?
The most interesting that how the Nordic countries went far in data integration, data analytics, and provide the necessary knowledge to learn more about the things we are just talking about.
Yeah, it's an amazing setting for this conference, isn't it? Zoltan, thank you so much for being with us. We really appreciate it.
Thank you very much.
Thank you, Zoltan.
Thank you.
Cheers. Thank you.
Thank you.
Thank you.
Bye.
So Charles, this is like the second or third time we've gotten to talk about where technology really meets people.
Yeah.
And I think that's so interesting.
And really, we're really touching here on precision, predictive, personalized prevention.
Yes.
This is where it's at.
Yeah, absolutely.
And that's the sort of embodiment of where we're going.
Absolutely.
Great.
So amazing. So our next guest is here. We're pleased to welcome to us Petteri Kivimäki, who's the CTO of the Nordic Institute for Interoperability Solutions. Welcome.
Thank you very much. It's very good to be here.
It's great to have you with us. Why don't you kick off by telling us a little bit about what you're speaking about here at the conference this week?
Yeah, so like you said, I am representing an organization that is called Nordic Institute for Interoperability Solutions, NIS for short. We are a non-profit association founded together by the Republic of Estonia and the Republic of Finland. And our mission is to develop e-government solutions to our members, and we are kicking off with X-Road data exchange layer. So we are a non-profit organization developing software for 2 countries.
Wow. And again, we're back to the frontiers here. I mean, we come from jurisdictions where when we want to enter into the digital world, we get asked for our authentication data at least 6 times for a simple process. And here you have a system whereby you've asked once.
Yeah, well, that's
and also you have a system which is even more exciting, I think, where you have transferability of that identity to the different aspects of government. This is really where all governments are hoping to get to. You're just there a hell of a long time before the other guys.
Yeah. Originally, X-Road was developed in Estonia almost 20 years ago already.
Wow.
And today it is used worldwide by more than 10 countries all around the world. In Europe, it is used by Estonia, Finland, and Iceland is also implementing it at the moment. And another key benefit of X-Road is that it enables cross-border data exchange and also cross-sector. So now when Finland and Estonia are both using X-Road, they have the technical capability to exchange data cross-border in secure and standardized way.
That's amazing. It feels like technology is finally catching up to the way people actually live and move around, right? We're never in the same place for very long. And one of the biggest challenges when you change countries is that all your data gets left behind and you start again like as though you were just born in this new country.
Yeah.
How did you guys start on this journey so long ago?
Yeah, so like I said, originally X-Road was kicked off in Estonia almost 20 years ago. At the time, they didn't have an existing integration solution, and they needed to connect different information systems with each other. And at the time, actually still many commercial solutions, they are very expensive because of the licensing fees. Yeah. And Estonia, as a small country, they didn't have so much resources, financial resources. So instead of buying a commercial solution, they decided to implement their own. And that's how X-Road was originally born.
Interesting.
And then years later, Finland decided to implement it as well, because we had seen that it worked very well in Estonia, and what kind of benefits it can bring to us.
And if we think in terms of the potential for the European Union, for example, we really, we have aspirations to have a health system in Europe, which is similar in the different member states. So the potential for using something similar, because you are the first to really make this happen in Europe.
Yeah.
I think the potential is enormous, and clearly, without you starting on that process, no one was going to get very far very quickly. The thing which I think is always going to be the biggest obstacle to this is governments willing to share. Now, we have a pretty unique situation here between two countries that actually have a very close affiliation for many years, Estonia and Finland. But there still is this reticence about sharing, I think. Do you see it in your work? Not in the work, in the people you're working with, but when you're looking outside?
Well, I wouldn't say that there is problems with will to share. I think there are many practical things like legislation. I mean, there are many organizations in Finland and Estonia that would like to exchange cross-border data. We have the technical capabilities to exchange cross-border data, but there are questions regarding legislation that significantly slow down the process for the actual implementation, or in some cases they might even prevent it completely.
How do we speed that up? Is there a way to sort of nudge governments and move them this way, or is it GDPR sort of rearing its head and putting in roadblocks?
No, this time it's not GDPR, it's something else. But I think that some kind of a legislative framework would be needed regarding cross-border data exchange, not only between Finland and Estonia, but also in EU level, because these are kind of problems that pop up everywhere. It's not a country-specific problem.
It's quite interesting you mentioned GDPR, actually, because GDPR is often used or thought of as the villain in this piece, and I really believe it's not.
I agree.
Because it protects us all, really, and that's what it's meant to do. I think sometimes its interpretation can be quite interesting.
That's right.
Because like all legislation, there are different ways you can interpret it, and one can take a very rigid, risk-averse approach to it, or one can take a somewhat more practical and pragmatic approach. And some countries certainly haven't yet understood they can take a pragmatic approach and are concentrating on the rigid approach.
Yeah, that's definitely challenging, and we have practical examples about that also with X-Road, for example, logging. Because X-Road provides logs. Every message that is sent over X-Road is logged, time-stamped and digitally signed, and then it's possible to use those logs afterwards as an evidence in court, for example. But in Estonia, everything is logged and the logs are stored. But in Finland, that kind of a feature was considered a problem, and here the actual message payload that is being transferred, for example, personal data, that is not logged, only the technical information regarding the data exchange, which of course means that then those logs are not usable afterwards because they have been modified during the process.
Yes, so you somehow don't have one version of the truth here, in my simple
two different interpretations of the same thing.
And how do you move past that?
Well, X-Road is very flexible system. It can be configured. So both countries, they run exactly the same software, but they just configure it differently.
Right, right. And so moving beyond Estonia and Finland, what's next? Where's next? Where's sort of the next, I guess, easy win to introduce this?
Easy win. Well, we just released a new version of X-Road that supports providing and consuming of REST services. Earlier, X-Road supported only SOAP, which is an older technology. For example, Google quitted using it already over 10 years ago. Nowadays, almost all the new information systems use REST. And now the new version is out there, and we expect many new organizations to join X-Road in Finland, in Estonia, in Iceland, because now it's very easy to produce and consume services.
And in terms of countries, where do you think you're moving next? Where's the next big, you said potentially Iceland, but beyond that, is there ambitions of Liechtenstein? And 'cause I hear there are all sorts of potential opportunities.
Yeah, there are lots of opportunities. Well, Iceland is not just an opportunity. They are already our partner, and they are implementing X-Road. But then our main target is in the Nordics. We are currently talking with Sweden, Norway, and Denmark. And of course, all the other EU countries are very, very interesting targets for us as well. And we've had some initial discussions with some other countries in EU as well.
Amazing. So things are moving forward. Unfortunately, we are almost out of time. Before we have to part, though, I'd love to hear from you. What's the most interesting thing you've seen or learned this week here at HIMSS?
To be honest, I have to admit that I just arrived here because in the beginning of the week I was in Bucharest at the European Union Sharing and Reuse event. I was giving a presentation there, so unfortunately I didn't have time to arrive here earlier.
It's all right. There's plenty time. We got a few hours left. There are some good presentations, and actually there's a lot to see on the floor.
You're going to be busy for sure.
That's good.
So we're going to wrap up this discussion around interoperability with a special tour of the Interoperability Showcase that's here at HIMSS. Let's take a look.
Hello, this is Stephen Wellman. I'm here with HIMSS TV on location at the show floor of HIMSS Europe and Health 2.0. I'm here today with the Nordic Interoperability Project, and a couple of the member organizations here are going to tell us a little bit about it. So how did the Nordic Interoperability Project start, and how did you guys come into being?
Yeah, actually it was initiated a year ago at the CITGES conference. Our idea was that engagement for the patient is the new era, collaboration. So it's all about how we can, from industry, support the patient's journey from country to country, but also within a country. So you can easily retrieve your information, you can access services, and of course, live a better life.
If you could tell our viewers a little bit more about your role in the project and where you see things going in the next 12 months.
Well, first of all, I've been part of the HIMSS Advisory Board Europe for quite many years, and we've seen that the maturity of the Nordic market has been very good, meaning that population have trust in the society, so they can be ready to also interact with their information. And why we're doing this is because if you look to the providers today and their need for efficiency, this might be the last step they have to get, patient self-service, doing more of their health care, meaning that we can reduce cost for inpatient and maybe do more predictive care. So I would say that this might be a foundation actually for AI development if we really get it through. And these 25 million people in the Nordic region is a super good test bed for that kind of solutions.
We are one of the founding fathers of this project together with Cambia and Sectra. We hope to just get more companies and more academia, more hospitals and patient organizations on board, because we want to form this critical mass where we cannot be neglected anymore, so we can really drive this development of interoperability. If we get all these Nordic countries on board, we make this relevant mass out in the world, more or less. So we could be the test bed and also the platform for trying out all different concepts. It's about taking small steps, I think, for us to make this change happening around. So that's why we do it from the patient perspectives with these different case scenarios. So we hope to have many more case scenarios and more partners coming on board helping us out driving this.
We hear a lot about interoperability across the world in the different HIMSS conferences that I've attended in the last 12 months, but you guys here in the Nordics seem to be figuring it out. What have you guys done that nobody else has really been able to do to move the interoperability so much farther and faster?
Yeah, that's a good question. It's a bit difficult to answer, I think. But if I try, I would focus then on the cultures in the countries, social democracies. We trust in the government. We trust in the systems being established to the best of the patient. We pay tax money to the government, and we trust them to do what we find is best with that money. So that's one part, sort of a very from a high perspective. And then it's about collaboration and to feel that I can talk to a vendor who I'm competing with, but still we have the same vision for the patient. So the focus on the patient and me and all my friends and you as a citizen in the society here. Those are common values that we have, and I think that's one of the things that makes this possible.
For our HIMSS TV viewers, what's the one lesson you'd like to share with our provider audience here on HIMSS TV? One lesson that you've learned from this project in the last year?
It's a very good question. I would put it like this: never give up.
Never give up. What's your one lesson for our viewers?
Well, that was actually a good one, Jan. I would say cooperation over the borders. I think that is the key.
Okay. And your lesson for our viewers?
That so many others have the same agenda that we have. So when we started this project, people were ready to jack into the project immediately, and there were some objections, but they were easily sort of discussed together, and everyone's joining in. And it was a surprise, and very pleasant surprise, I would say.
All right, that's fair enough. We'll talk to you in another 12 months when we come back to HIMSS Europe at Health 2.0 in 2020. This is Stephen Wellman with HIMSS TV. Thank you for watching.
Joining me next is Catherine Meyer, who's the CEO of Norway Health Tech. Catherine, welcome.
Thank you so much.
It's great to have you with us. To kick off, why don't you tell us a little bit about what you're speaking about here at HIMSS this week?
Well, I had the pleasure of speaking at the keynote session yesterday evening.
Mm-hmm.
I was actually receiving an award from HIMSS.
Oh, wow.
Future 50 for the achievements that we have been able to actually achieve in Norway, and some of them in Europe as well. So I gave a talk about actually what's happening in Norway, and the position that Norway is about to take in digital health.
Amazing. Well, congratulations on the award.
Thank you so much.
Why don't you tell us a little bit about what's happening in Norway and what drove that award?
Well, I started out talking actually about Norway being pioneers. I mean, the long coastline, if you have been living on we have people living on the whole coastline in Norway, 5.3 million people.
Wow.
And in order to survive, basically, you need to pioneer, right?
Yes.
You need to think about solutions all the time.
Mm-hmm.
So we have been pioneers in oil and gas. And what we are doing now is actually taking both technology and people and knowledge from that sector, but also the culture of pioneering into health. We have a very good health system in Norway. I think we are recognized for it. We have a lot of health databases. There's a lot of potential in Norway, but we haven't really, brought it up to the surface. So my organization, Norway Health Tech, we started out 10 years ago, starting with all this potential and trying to actually, bring it to the surface. And now, 10 years later, it's booming on the startup scene. Wow. We have a huge growth in the industry of 8 to 10% yearly in value creation.
Wow.
But this is a new industry in Norway, so we're still, you know, the little sister of Sweden and Denmark, but really kicking off. And and also the healthcare system is. We have a culture in Norway that the providers, you know, they didn't really speak to the industry. And if you don't speak, if there's not a dialogue, how can the industry actually understand the challenges that we are facing?
Right.
So we have also been facilitating a lot of meeting places and having those that really have the challenges and are responsible to do things about the challenges in healthcare, meeting those that can actually solve them.
Right.
And that is now really changing the culture in Norway as well.
That's amazing.
So that even the politicians and the health minister and the industry minister, they are also now really focusing on health and health industry in Norway.
Well, and it sounds like you've now got everybody rowing in the same direction.
Exactly.
What were some of those biggest challenges that you faced in Norway?
Well, first of all, this culture challenge has been, it's been tricky. There's something about Norway and, you know, people, first of all, we have a single-payer health system in Norway, so it's a governmental system, and it's the government paying the kind of governmental insurance.
Yeah.
Yeah. So, and there has been this kind of thinking that, you know, can we mix that with those that actually are making money in the industry?
I see.
So we had to, you know, crack the code here. But we that are working also with and in the industry knows that people are driven by the mission of actually, you know, helping the patients.
Yes.
That's why they're there.
Yes.
It's not necessarily to make money. No. Okay, that's part of it.
Side effect.
Exactly.
Yeah.
So we had to really work on this, and also the government and the parliament and the head ministers as well, they were listening, and we brought them to Canada, to US, to different other, you know, countries to see, okay, how are they solving the challenges, and actually making a platform for dialogue.
Yeah.
Of course, you need to have clear rules on procurement and these types of things, but if you follow the rules, then there's a procedure for how to do this so that you do it right.
That's right.
Yeah.
And that's when real innovation and growth can really happen.
Exactly.
Yeah.
Exactly.
What's one of the achievements or projects you're most proud of? You know, solving a specific challenge. What are you most excited about that Norway Health Tech has helped to achieve?
Oh, there's several things, but of course, making the platform for startup companies to actually start and grow for entrepreneurs that do have that idea, and the entrepreneurs, they coming both from the health sector, it could be a doctor, it could be a nurse that have an idea, but so making that startup engine actually. I'm the chairman of the incubator. It's called the Leap. That is a big achievement. It's full all the time. It's more companies that want to stay there than we have room for, which is a good thing.
That's great.
Selection is part of it.
Yeah.
There are, you know, the growth of the industry, of course. That's a huge achievement. But also, I must say, working with the hospitals, working with the patients, solving their challenges, having companies that actually, they understand the challenge.
Yeah.
And for the companies being able to make products and solutions that really solve the challenge, that's at least that's also, you know, it touched your heart.
Of course.
Yeah. And that's also, I guess, the biggest motivation for being in the sector.
Right.
Is that it's really meaningful.
Absolutely. Well, you're really helping to change people's lives ultimately, right?
Yeah.
So I know we're here in Finland for this show, and you're based in Norway. The Nordics are really seen as leaders in that space, right? Overcoming those cultural challenges, mixing technology with a true, you know, desire to improve outcomes for patients. Why do you think that is, that the Nordics are so far out ahead?
First of all the Nordic countries have been, I mean, they've been building industries, right? Norway, oil and gas, Finland in IT, Sweden in several areas.
Yeah.
So, so we understand the technology part, I guess. And that's also what this is about.
Yes.
It's about bringing that technology into the health sector. At least for Norway, and that comes for Sweden, Denmark, Finland, Iceland as well. We are small countries. We have stable economies and stable political systems.
Yes.
And we are used to, I mean, we're quite good at building trustful relations.
Yes.
And these are also important ingredients when you are making the platforms where you face the challenges, have the challenges in the healthcare system, come to the surface, and combining them with those that actually can solve them, the industry.
Right.
That is at least part of it.
Yeah.
Yeah, and I guess we like to collaborate.
Yes.
Okay, we did fight war several hundred years back, but that's...
We used to fight, but we're friends now.
Yeah, exactly, yeah.
So what can countries who don't have, those sort of underlying factors like we have in the Nordics, particularly like we have in Norway, what can other countries where do they start to kind of follow the same path?
Wow, I think it's a lot to learn from each other. Look at Estonia. They've been so clever. They didn't have any system. They needed to install an IT health system, and they did it, so quickly. It took a couple of years.
Yeah.
They made a strategy, was approved by the parliament, and they, put aside money to do it, and then they did it. And it seems to be a good system. So if I'm just thinking loud now, but to have strategic leaders that see the need for things, actually reach out and find out, okay, how have others solved this? Is there something we can learn? And build partnerships across borders, across technology. I think that's at least one way to start.
Yeah. Well, you touched on a really interesting part. Our ongoing theme today has been that it's not really just about technology, but people, right? Yeah. Having great leaders, having people with the drive to do this. Yeah. Did that help in Norway? Did you have sort of the right combination of both technology and people to help you drive change?
This is also a theme in Norway. 5th of April this year, the government, represented by the Ministry for Industry and the Ministry for Health, together they launched a white paper on the health industry, the first ever in Norway.
Wow.
Yeah. And one of the themes that are addressed there is the need for, a mix of competence. For example, in the leadership, of hospitals, you cannot only put doctors being the leaders in a hospital, you need complementary competence. One thing that is coming out of that white paper is that we need to put up competence programs so that they also are able to understand what's the mission and what's the purpose and what's the outcome that could come out of actually digital health. They don't know it, Right. They didn't have it as part of their education. So we need to re-educate and,
You need that sort of cross-functional skill set.
Exactly. Yeah.
In the same way as you would never have a hospital run by someone who has no medical background.
Exactly.
You wouldn't necessarily want a medical tech company run by someone with no medical background.
No. You need a mix.
That blending of skills.
Complementary competence.
And do you see sort of medical schools and education sort of picking that up as a theme and starting to evolve how they teach the next generation of healthcare professionals?
We are in dialogue with several educational, I wouldn't say universities, not yet, but the business school is active, and there's several initiatives now picking up on this. And over the next year to come, 2-3 years, this will be absolutely, and we will be a driver for also implementing these types of educational programs.
Amazing, because that's really how you drive change. Yeah. Catherine, we are almost out of time. Before we wrap, I know you just arrived yesterday and you had a busy night last night getting your award. What's the most exciting thing you're looking forward to see or to learn today at HIMSS?
Well, first of all, I would like to say that HIMSS is, just the award, and back in Norway, Facebook, LinkedIn, it's really booming with a lot of congrats. So to say big thank you to HIMSS. HIMSS is
amazing, right?
Yeah, it's a big name or an organization, and it has attraction. One of the maybe most important things is the network. This is a huge network event.
Yeah.
This is where you meet people that can solve these challenges.
Yeah.
So making use of that opportunity, that's what I'm really trying to do.
Yeah.
And also, of course, there's a lot of interesting companies and a lot of interesting booths, and but the networking is really, really what do you say? They're really, that's the big thing.
That's the most important thing, for sure. I think that's one of the biggest elements for everyone.
Yeah.
Catherine, thank you so much. This has been incredibly interesting. We really appreciate you spending some time with us.
Thank you for having me here.